Hello and welcome to Let's Talk Health. Let's Talk Health is a production of the Government Information Service highlighting the plans, programs and policies of the Ministry of Health and Social Security. In today's program, we'll take a moment to analyze the Ministry's revitalized primary healthcare program, which was officially launched July 24th at the Satels Health Complex in St. Patrick. I am Kevin Frederick. Dr. Francis Martin is the Director of Primary Healthcare and he joins us to explain what progress was made thus far. Dr. Martin, welcome. Primary Healthcare is the flagship program of the Ministry of Health and by extension government, given its support and commitment for healthcare, especially at the primary level. We're at implementation stage with the necessary systems in place to ensure that our clients can access and benefit from a range of services being offered in this program. Put into context where we are and what clients can expect when they visit their respective health facilities, especially in the northwestern district of the island, that is St. Patrick, St. Mark and St. John.
All right, well, over the last few weeks, what we've done from the launch of the program was to put the systems in place to ensure that we realize the changes that we expect to see on the ground. A few things we've done very significant to help the system to respond well to the primary healthcare is one, the employment of our district health service manager. This is a man that's on the ground who is going to look about the day-to-day administrative issues of the program, because as you can realize, there's quite a number of things that needs to be looked at. We have also done a very significant thing, which is have on board additional personnel, specifically as it relates to the physicians and the nurses. We have employed 2 additional physicians who are located and living in the area. One is living in the St. Mark area and another one is living in the St. John's area. And the reason for doing this is because to have adequate response and quick response in terms of emergencies and other things, the physicians are actually living there. Having the physician on the ground gives us an opportunity to implement a very important aspect of the rollout, which is the extension of hours of services. In the St. Patrick's Health Center, we are now able to do extension of hours so that the patients have access to the physicians from the morning to the evening every day of the week, and that's happening only at the Satels Health Center. We've also been able to get on board a number of nurses who are actually on the ground at the moment. In fact, they're beginning to work with the community outreach program. I was very encouraged to learn from our chief nursing officer that the numbers of community outreach and contacts have actually increased already over the last few weeks. We're able to do some more foot care, we're able to do some more postnatal checks, and those are the kind of things that we really want to meet people on the ground. Also, training has commenced. Training was part of the primary healthcare elements that we hope to do. Mental health is going to be doing their training. Some of the nurses have also gotten some training, and more training are in the pipeline for them. So in other words, we are beginning to beef up the system so that the system can adequately respond to the demands that is going to be placed on them as people get more and more aware of the different services that we offer in our primary healthcare program.
That was Dr. Francis Martin, the Director of Primary Healthcare. And now, for your health tip. Did you know that the high potassium content in prunes helps to normalize blood pressure, while the soluble fiber promotes heart health? Guess what? Prunes can help prevent cancer because of its high beta-carotene content. It's a good remedy for sore throat, it helps normalize blood circulation, increase vitality, slows the aging process of the brain and body, and it contains a lot of fiber and sorbitol, which is a stool-loosening sugar. That brings us to the end of today's radio show. Until next time, stay healthy and well.